Hi, my name's Romy. Thanks for inviting me to present on the topic of urinary obstruction as an overlooked consequence of rectocele. I have no affiliations to disclose. Worldwide, about 10 to 20% of women will undergo surgery for prolapse in their lifetime. However, many women don't seek medical attention due to societal and health system factors, and there is limited data on prolapse in developing countries. Some women may also remain asymptomatic. Taking this into account, pelvic organ prolapse affects a large number of women, and this number is likely to grow due to increasing prevalence of etiological factors such as obesity. Rectocele is a form of pelvic organ prolapse where the rectal ampulla bulges into the posterior vaginal wall. In the literature and in primary care, the focus is on rectal and vaginal symptoms. Urinary symptoms and obstructing voiding are sometimes described in association with large cystocele, but not rectocele. Clinical experience prompted us to investigate the relationship between urinary symptoms and rectocele. This picture shows the anatomy of rectocele. In addition to causing rectal and vaginal symptoms, it's not too much of a stretch to see how a large rectocele filled with fecal material could also obstruct the bladder neck or urethra. To date, there are only 2 studies describing this, one from 1998 investigating where the posterior vaginal wall defects can mask stress incontinence, and the other from 2003 with urodynamic studies for a series of 23 women. We aim to describe rectocele and voiding dysfunction in a larger cohort of women, under the premise that women with symptomatic rectocele may experience voiding dysfunction in addition to vaginal and rectal symptoms. So to do this, we reviewed the medical records of 177 women who had undergone isolated posterior compartment repair and collected demographic data, quantitative and qualitative information on urinary symptoms and operative outcomes. We found that most women had been referred from the general practice setting, around 80%, and the most common reason for referral were actually incontinence and LUTs that could no longer be managed in a primary care setting and were affecting these women's lives quite significantly. I wanted to highlight that around 20% of referrals specifically mentioned prolapse as part of their diagnosis, but the other 80% did not. And also that a small percentage of women actually presented as a result of acute urinary retention or chronically elevated post-void residuals, and then went on to have the diagnosis of rectocele. All women underwent urodynamic studies and clinical examination. Around 80% of the cohort had grade 3 and 4 rectocele, and the remainder were grade 2, so all considered to be clinically significant in the literature. And what was found was that around 30% of the cohort did have evidence of voiding obstruction on urodynamic studies. And our definition for that was a post-void residual of over 50 mils for those under 70 years and greater than 100 mils for those older than 70 years. And in addition to those quite quantitative results, we also found that nearly half of the cohort experienced subjectively the feeling of incomplete emptying, and over a third of women needed to adjust their voiding position in order to empty. Of those with a clinically elevated pre-operative post-void residual, which as I said was about a third, half had post-operative PVRs that were no longer clinically elevated. About 20% didn't show a clinically significant reduction, so their post-void residuals were the same or reduced, but not to a clinically acceptable volume, and around 40% didn't have any post-operative data available for comparison. However, it is important to note that clinically, about 90% of the cohort responded that their urinary and rectal symptoms had resolved post-operatively and were very happy with the outcome. Those that didn't experience resolution of voiding symptoms had evidence of detrusor overactivity on urodynamic studies, so they went on to have medical management of overactive bladder. In terms of other urinary symptoms, as reflected by the referral reasons, many women did experience incontinence and also had bothersome lower urinary tract symptoms. So only about 16 and 23% of women reported no LUTs and no incontinence, respectively. Vaginal and rectal symptoms were also assessed, and I really wanted to highlight that the majority of women reported concurrent rectal symptoms typical of rectocele that hadn't been discussed with the referrer. This had previously been investigated with a study looking at primary care evaluations of issues like hygiene, digitation and splinting. And this study found that these issues are often unaddressed in primary care, both because of a lack of awareness and a reluctance to discuss these concerns. So rectocele can go undiagnosed and cause significant morbidity for a long period of time. Despite the focus of this study being to demonstrate that rectocele can cause voiding obstruction, it also shows that perhaps more needs to be done to raise awareness and facilitate discussing rectal symptoms of rectocele in the primary care setting. In summary, our study demonstrated that women with symptomatic rectocele can present with voiding obstruction and urinary symptoms. These symptoms might occur along with other more typical symptoms of rectocele, so suspicion of prolapse should be accompanied by a review of the whole spectrum of symptoms, rectal, vaginal and urinary. Urodynamic studies might be appropriate in the workup of women with rectocele, and surgical intervention can effectively relieve symptoms in selected women. Thanks so much for listening.